already be draped right here. And all you're gonna do is set up yellow to yellow. After the vacuum line is on, you're gonna wanna make sure that this bottom reservoir is clamped, otherwise it will leak blood and fluid all over the floor. Before you start, you'll want to grab this green suction line and this 40,000 unit bag of heparin that you can find in the surgical pharmacy. This will be handed off to the field where they'll eventually hand you back part of the line to be hooked up to the cell saver. You want to turn the suction on before you hook up your heparin solution. All you have to do to turn the suction on is go to the screen and hit Smart Suction. The field is going to hand back this portion of the line. It is going to have the blue cap and the spike. You're going to need to separate these. And blue is going to go right here to this blue. And then you'll want to spike your heparin solution. The heparin solution ensures that this line does not get blood clots in it. Once you spike the solution, you're going to run 100 of the heparin solution into this sock. When there gets blood in there, the sock can get clotted off, so you want some sort of heparin solution in there. Once you have 100 of the heparin solution in there, you're going to want to adjust this drip to about 1 drip every 1 to 3 seconds. It should be about that slow. There will be 2 stickers on top of the reservoir. This yellow sticker is your charge sticker for this reservoir, and this is the lot number for the reservoir. You'll want to put the lot number in the chart. After you're done with this, you can throw it away, and this will be on your charge sheet. Once you have 2.5 times your bowl size, you are ready to process your cell saver. To find out what size of bowl you have, we have 2 sizes at Altru. We have a 125 and a 225. Underneath the cell saver, you will find a top sheet. On the top sheet, it says what size of the bowl it is right here. On this top sheet, this is where you're going to find the lot number for the chart and this kit cell saver sticker for your charge sheet. To hook up the cell saver, you're going to start with a red-to-red connection. This goes right here underneath the reservoir, and you'll want to make sure both clamps are open. This one is open. You will hook up either 1 liter of sodium chloride or the big 3-liter bag of sodium chloride if you think you'll be processing a lot. Make sure that one of the 2 clamps is clamped, because otherwise it will drain all over the floor. For the blue line, you want to make sure that these 2 small clamps are clamped, because otherwise they will go all over the floor. This big clamp needs to remain open, and so does this one, which bowl size, which is found underneath the cell saver reservoir. There's also 2 pictures that reference what the bowls look like, so you can also just look into the machine to see which one it is. This is a 125, so I'm going to click 125, and then follow the prompts. Low disposable, start procedure. This is a very common error that comes up. The effluent line is this line inside their device, and all you have to do is push it back in and then close it. To get it to go, if it doesn't go, you can always push play. Now it is going to prime the machine before it starts taking blood from the reservoir. When the machine is done washing with 1 liter of normal saline, it will push blood up into this bag. If it is a 125 bowl, it's going to process 125. If it's a 225, it will give you 225. This blood is ready to go to anesthesia. It has a long line, so you can often keep it connected when you hand off to them in case you get more blood later on in the case. The Cell Saver requires that you use one of these orange filters, so anesthesia will need to use one orange filter on one of these small lines to give back the Cell Saver blood. If you get an error detected during fill, that just means that there is not enough blood in your reservoir to process a bowl yet. When you're all done with the case, you're going to click End Procedure, and it's going to ask you to confirm, and you can just click End Procedure again. This is where you're going to find your volumes that you are going to put in the chart. So there's the total process, total wash, and total re-infusion. When you end the procedure on the Cell Saver, you want to make sure that this blue line is unclamped because it is going to purge any leftover blood in the line up into the bag to be given to the patient. If it is clamped, you're going to overpressurize the system. To detach this, you're going to unscrew this and use this cap cap it, and you're going to bring this dirty bag into the garbage room, and you're going to drain this solution into the hopper and flush it. To tear down, you will take the reservoir and the blood bag and throw it in the garbage. And you'll open up the device cover. There will be 3 unlatches that you need to unlatch. And then you'll grab the Latham bowl, and then pull it out and throw it in the garbage. Now it is ready to be set up. To start the setup, you'll need 3 things. You'll need a vacuum line, a processing kit, and a hard shell reservoir. To set up, we'll put the reservoir on here, and you'll need those 2 stickers, the lot number that's in there that you'll stick on top, and the charge number for the next person to use. You'll take your vacuum line, and this special end goes into the back of the machine, and then you will just drape this line, don't attach it, right here for the next person to use. You'll take your processing kit and you'll take off this top sheet. This top sheet must go underneath the Cell Saver for the next person to have the lot number and charge sticker. Then you will take your processing kit and you'll pull this out and place it right here. You then can take out this bag first and bring it out, and you can drape this over there and stick the Latham bowl in. It needs to click in, and then you can start the rest. These 3 lines need to be untangled. After they're untangled, they can drape right here. And you put this under here, pull up, and then you'll put this line in here and stick these all in here. Now all 3 of our latches are ready to be latched. We'll first start with the blue latch. Once these are flush, you can push this in, latch there, and then the Latham bowl latch up here. You want to make sure that all 3 of these have been latched. Then you'll drape this down. And you'll hang this blue bag up here. You'll want to make sure that these blue small clamps are clamped for the next person to use. The red and the yellow will stay draped over here. And then you want to make sure that the reservoir clamp is also clamped.